Good Friday morning, everyone. I'm Dr. David Wild, Vice President of Performance Improvement, and again for Dr. Steve Stites, our Chief Medical Officer. We're coming to you from the Dolph Simons Jr. Family Broadcast Studio. And in studio today, Dr. Kevin Alt, an obstetrician and member of the CDC Advisory Committee on Immunization Practices, joins us again today to help answer questions around the Johnson & Johnson vaccine and share some added benefits from vaccination among expectant and new mothers. But first, Dr. Dana Hawkinson is with us, as always, our Medical Director of Infection Prevention and Control, and he's here with some numbers, and my tone probably foreshadows just a touch.
Yeah, it does. Well, I think in the United States, I think the numbers are a lot better. I mean, they are continuing to go down, but locally in the metro, we know that the daily case rate, the 7-day average, is continuing to rise. And unfortunately, here at the hospital as well, we've had to go, for the longest time, we have been now just on one unit of our critically ill and our typically regular. We are housing them in one unit, but now we had to kind of spill over into a second unit again. So we haven't had to do that for quite some time, a few months. Right now we have 17 active patients with 9 in the ICU and 3 on the ventilator, 14 in that recovery period, so 31 patients kind of creeping up there. Hays is still doing okay, 1 active patient and 2 in that recovery, so 3 total as well.
I think interesting to me what we're seeing here, and this is likely to continue, I think, but a year ago or 6 months ago, we saw new cases increase, and then we had a buffer. We had some time to prepare for more hospitalizations. And what we've seen this week, and it's not just us, I guess we should say we have connections and contacts across the metro, and everyone really has seen an increase in the past couple of days. What we've seen is a almost immediate increase in hospitalizations after an increase in new cases. And I think that just reinforces we're not testing enough, right? A lot of these that we're seeing here are getting tested when they're really ill rather than having a really good picture of maybe more mild disease or asymptomatic disease. And I think we're seeing the implications of that. So
yeah, I think for many reasons it's one more part of weariness syndrome. It's we've heard stories about people not wanting to know because then they don't want to quarantine themselves or their loved ones. So I think it's for a variety of reasons why that is going on.
And you know, we regularly get this question: well, what do those people who are in the hospital look like? Are they younger? Are they how ill are they? Have they had a vaccine? Nothing really has changed there, right? Younger people.
Yeah.
We've talked a little bit about one that we know of with significant symptoms who's more than 2 weeks after a second dose of vaccination. But this is really consistent with what we're seeing in the community, right? Those unvaccinated patient populations, primarily age groups here we're talking about, are the populations where a larger percentage of that group is unvaccinated are the same populations that are making up a larger percentage of the hospitalized now. And really, I think the news of the last few days, we talked yesterday a little bit about pediatricians' offices, and the news of the past few days, right, is this sort of high school thing going on.
Yeah.
One high school in the metro with a couple hundred, sounds like, new people on quarantine this week, and not in the classroom, related to other activities. Where masks aren't worn. And so I think that just reinforces everything we've been saying for months now, right? Masks matter. We can do classrooms safely. Things that you take masks off for, whether it's, you know, a restaurant or some other activity, you know, sports or other activity, those are the times where we're at risk of transmission now, because we know that those pillars of infection prevention and control, mask wearing, right, physical distancing, those things remain true today, just like they were 3 months ago, 6 months ago, a year ago.
Exactly. There's still recommendations to be doing that. And we know how the disease spread, where it spreads. And it's indoors. It's those close settings. It is without masking. And nobody wants to wear a mask. We have not wanted to wear a mask. But the virus does not care about that. So at this point in time, we still have to do that. It's important to do that in those settings where you cannot space and in those settings where you're indoors, and especially unvaccinated.
Well, before we jump more into conversation about those values, your questions, and Dr. Alt's insights, are there any reporter questions this morning?
Sure, I'll kick things off. Cody Holyoke with Channel 9. Good morning, everyone.
Good morning, Cody.
Morning. Cody.
Hey, Dr. Hawkinson just touched on this a little bit, but with the COVID cases rising, what you're seeing now, it's hard to rectify that with now these new openings, these easings of restrictions or removal of restrictions in our area. So talk a little bit about that if you can, and your concerns right now.
Well, you're right. I think first, I guess, well, let's say across the metro this week, we have seen that there have been changes in existing mitigation strategies or mandates or changes in wording, right? Johnson County saying we're no longer going to mandate masks, for example, yesterday, but we strongly encourage everyone to continue adhering to the things that they know will keep us safe. And, you know, there have been questions for a year now about the impact of a mandate versus a recommendation versus very clear guidance. And I don't know that we have any new insight into those conversations. I think from our perspective, it remains true that we know what works to prevent transmission of this disease and to keep people out of the hospital. And that are, you know, those things haven't changed. Maybe we've added vaccination in the past 4 or 5 months to that mix, which is a great new tool. But for those unvaccinated, and even for those vaccinated in certain high-risk circumstances or situations, the rules are sort of the same. The virus hasn't changed. It's not gone away. We're still here. So, Dana, you probably got many more thoughts there, too.
Yeah, I mean, it's all in line with that. You know, we understand, especially when Texas removed or had their mask mandate repealed or ended, there was still a lot of businesses and a lot of communities that continued to do the masking in those situations, and that's indoors. Closed situations where you can't separate. And plus, you never know who is vaccinated or unvaccinated. So it's also when you're mixing those populations as well. We know what saves, what helps us, what helps prevent the spread of the disease, and ultimately hospitalization and death. And that is the masking, the distancing, the vaccines. We need to continue to do that. And we need, you know, businesses and private entities to continue to endorse and recommend the mask use for their employees, for their patrons, to keep everybody safe so that we can get back to normalcy. You know, there was a quote saying, we are getting back to normalcy. We want to do that. The virus hasn't gotten that memo yet, so we still need to take those precautions and those recommendations to keep each other safe, because we can do it, and we can get back to continuing to open up the economy and keeping people working, but it has to be in that thoughtful manner, doing the right things.
Great. Any other questions on the line this morning?
Before you ask him, I'm sure, a few questions about the Johnson & Johnson vaccine. Dr. Alt, I'm just curious how things have been going, what you've heard about the Johnson & Johnson rollout. And I know that it came with a warning this time, and I don't want to steal Dr. Wild's thunder, but if you could talk a little bit about that.
Well, we had 2 meetings very close together of the Advisory Committee on Immunization Practices. I'm one of 15 members of that committee. We had a meeting when the pause was announced. We had a meeting about 36 hours after the pause was announced. Then we had another meeting 9 or 10 days later. So the meeting 9 or 10 days later was just last week, and we went over 15 cases of this very unusual TTS syndrome, which is blood clots and low platelet counts, and looked at some of the risk factors and that type of thing. So basically what we found, the short version of what we found, is that this problem skews towards younger people and also skews towards women. All 15 cases were women. When you look at thrombosis in the brain, the CVST as it's been called, that it's the same skewing. And so we, you know, you mentioned the warning. We want to be sure that patients that are being vaccinated, there have been about 8 million Americans that have received the Johnson & Johnson vaccine already, you know the risks, know what to look out for. I think we also want clinicians to know, and you know, and any providers that are listening in today, to think about this. If somebody's had the Johnson & Johnson vaccine or the AstraZeneca vaccine in 3 weeks and has an unusual presentation with severe headache or abdominal pain, to look out for low platelet counts and blood clots. It's not very common, and it can be deadly. You know, we have a certain workup we want people to do.
Thank you.
Sure, Cody. Any other questions on the line this morning?
Yeah, this is Dan Cohen at 41 Action News. I just wanted to ask about something you said a second ago, just to clarify. The larger percentage of those who are hospitalized are unvaccinated. Did I hear that right? I just wanted to clarify that.
Yeah, so two clarifications. Number one, almost all of the patients who are hospitalized are unvaccinated. Number two, when we were talking about sort of populations or age groups, age bands, we've seen this shift, right, from even 6 months ago, before vaccines were really available. We saw a lot of patients in the hospital, a greater percentage of those hospitalized who were in their 60s, 70s, and 80s. Now we're not seeing the 70s and 80s, not as many of the 60s, and a lot more 40s and 50s, even 30s, some 20s this week. And so the commentary there is our hospitalizations have become proportional. The percent of those in the hospital have become proportional to the percent unvaccinated in an age group. So 20s and 30s, we know, are the groups right now that are less vaccinated. They're making up more and more of the proportion of the hospitalized patients every week. Hopefully that covers the bases there. Any other questions? All right, we'll turn back to Dr. Alt. I know we've introduced this concept of the advisory committee, the meeting, I guess a week ago today now, it was last Friday, and the outcome of that meeting, which was to resume using the Johnson & Johnson vaccine with the warning you mentioned. As part of that process, the 15-member committee voted, I think, 10 yeses to continue using or to reinstitute the use of the J&J vaccine. You mentioned a little bit of the clinical scenario, the numbers, the picture that was present for those having this complication. But what other information did the committee consider in making a determination?
Well, I think we really looked at populations that might benefit from a single-dose vaccine. And in the public comments and also in our liaison members, there are about 70 or 80 medical associations that also attend the meeting and have input. They all felt that there was probably a niche for a single-dose vaccine. And so, we just had to weigh the data. What happens for these vaccines is that the emergency use authorization is done by the Food and Drug Administration, the FDA, and then we make clinical recommendations. And so we had our meeting on Friday, and then on Monday or Tuesday, there was a much larger document in the Morbidity and Mortality Weekly Review, which is a publication of the CDC, usually called clinical considerations around the vaccine, and specifically for that warning. It was a 10-4 vote, but all 14 of us that voted all pretty much said the same thing. We were concerned about this rather unique clustering in younger people, in women, and wanted to be sure that people knew about the risk and benefits of this vaccine. We have to communicate that, obviously. So can we show the graphic?
Sure.
Speaking of communication, I took this off
Logan's
Facebook.
Magic, yeah.
So this is from the CDC's Facebook page. So, and I think this is an example of one of the things that, we need to do, and the CDC does well. They have good health communications, and so this is the patient part of it, to how to talk to patients. And so the highest rate, if you just looked at women in their 30s, was about 12 per million. As you can see, if you get away from that group, it's about 1 case per million. One of the things I thought was interesting about this, and if we put this up on our Facebook page, I'll put a link to this. We had a hematologist talk to us before as kind of a table setter for the whole meeting. And, the pathophysiology of this, why it causes this, is not well understood. So, and if it's a 1 in a million type of thing, it may be a little while before it's well understood. So,
and this sort of conversation around how we talk to patients, I think, is really important, because last week, around the same time as the vote, there was at least a couple of surveys. There were a couple of surveys that showed that maybe 70% or more of patients did not want to receive the J&J vaccine because of these concerns. And so you've mentioned, right, outside of this very specific population, the risk is maybe 1 in a million, and that may be the same as the general risk for this. It's so rare.
Right. COVID certainly increases your risk of blood clots. I mean, there's no doubt about that. I think 1 out of 20, if I remember my data correctly, of hospitalized patients with COVID have blood clots. So it's certainly much greater than 1 in a million. There are a lot of things we do in life, like getting in the car to go get the vaccine, that are probably more than a 1 in a million risk of a bad outcome. So so it's very hard to talk about these very small risks, and everybody weighs their own risk differently. I think if you want to get the other vaccine, of course, that's a 2-dose vaccine. The other 2 vaccines are available by EUA, and we certainly want you to get both doses. I was on the national media earlier this week and got asked that question specifically. About 8% of people that get the first dose don't get the second dose of the RNA vaccines, and so you the patient need to talk to your providers and listen to the news and look at the CDC's Facebook page and get as much information as possible and look into this yourself and decide what's best for you.
And just to sort of reinforce this point about second doses, we've heard that number, right, a sort of doubling of the percent not showing up in April compared to previous months nationally for their second dose. For our community and for those viewers today, that has not been our experience here, which I think is great. I think we've really reinforced the importance of that second dose, that there's a very good reason that it's part of the regimen. And in our clinics, we've not really seen any significant change in the number of people not showing up in April as compared to previous months. So while we do have maybe a 1% no-show rate any given day for any vaccine appointment, that hasn't changed, and we're not seeing people avoid the second dose in our practice. And I hope that's true across the metro. It's a little bit harder to know that sort of look across all of the vaccine clinics. But in our experience, we're not seeing that.
That's good news.
It is. One of the other things that you mentioned any population where a single-dose regimen, the J&J regimen, may be beneficial, right? That was a key reason for sort of voting to say this has a very important place in our sort of armament, if you will, our tool belt to offer vaccination. We know that can be a lot of different groups. One might be people who have to travel distances, whether that be rural or otherwise, to receive their vaccine. And we know that those groups are sometimes particularly hesitant. You've shared this CDC graphic. You've talked about the reasons that the advisory committee voted to continue or restart the use. Is there any other message you would give to people who are hesitant, specifically around the J&J vaccine?
Well, I would probably, as far as hesitancy, I'd probably talk about what you guys talked about earlier in the week, about the example of Israel. And so, Israel obviously is a very different country than the United States. However, they have done very well as far as COVID deaths and COVID hospitalizations. And they have about twice their population vaccinated compared to the United States. And so if there is, going to be back to normal, as was mentioned previously, we've got a long way to go. And the Johnson & Johnson vaccine is probably going to be part of that. I think is the take-home message. We basically need to double the vaccination rates we have now in the United States.
One of the other questions, pivoting just a touch from vaccines, one of the other questions we've been getting a lot is, what do we think of new masking guidelines, specifically relaxing masking requirements or guidelines for those who are vaccinated and outside? Did the committee talk about anything like that as you think about how to suggest vaccination?
We don't usually talk about that specifically. However, of course, there's some overlap between the people in our group and the people that are making the masking guidelines. I think we knew when we were meeting on Friday they were going to come out. And, I, again, looking at the CDC's Facebook page, not that that's where I get all my medical information, but, they do have very detailed, and I actually printed it out for myself, very detailed graphics about what you can do and not do as far as indoors and outdoors. And so, I think that's a sign that things are becoming more hopeful, but not a reason to relax. I'm not the first person who said that. I'm borrowing that from President Biden and a lot of other people. But, I think that's good news overall.
I would agree. Jill, I know we have a long list of questions today that have built up over the week, so let's jump into some of those questions from the
I'm going to
community.
give you three real quick ones that just came in this morning that I think are worth talking about. Kristen wants to know, when will the FDA consider an EUA for Pfizer for 12 to 15-year-olds?
I think I know the answer to that. You want me to handle that one? So soon. The typical timing has been about 3 to 4 weeks after the company puts in the EUA, and a lot of people I work with have children in this age range, so I've been getting the question quite frequently. So April 9th was when the EUA went in, so we should be having a meeting any time now. There's an FDA meeting that happens, and then a ACIP meeting that happens in short sequence. So any day would be the short answer to that.
All right, Susan for Dr. Hawkinson.
Yeah.
If someone in their 20s had COVID 1 to 2 months ago, how long does she have to wait to get the vaccine?
Not long. Get it.
Go.
The recommendation is to get the vaccine as soon as possible, and that really means, there is no minimum time between infection and vaccination. That's the actual guidance. We don't want you to get the vaccination while you're acutely ill, so you have to wait that 10 days of your isolation period before you can get it, but you should absolutely go get the vaccine now. Really get it, after that 10 days essentially is going to be the official guidance. There's no time to wait.
Okay, and for the panel, Shelley is watching the CDC site, so yay, Shelley, good job. And she's reading where if you are not vaccinated and you fly, you need to quarantine when you get home, but if you're vaccinated for 7 days. But if you're vaccinated, you don't have to do that. She works in a daycare, and she wonders if the same should apply to the children of the parents who fly. She screens them. She'll say, how you feeling? Have you traveled anywhere?
I'm assuming in this question the children are not traveling, just the parents are traveling?
I do ask parents who are vaccinated and travel with their unvaccinated children.
So if the children are traveling and are unvaccinated, the recommendation from the CDC, as you describe, is to self-quarantine. And that's simply from the perspective that you're coming in contact with a number of people who are not normally in your bubble as you travel, whether that be to visit family or in the act of traveling, flying in this case. I don't know of any reason why children wouldn't be included in that recommendation to quarantine, but I also know there's no firm requirement. No one's enforcing that.
Correct, yeah.
And I would understand the challenge that presents in a daycare setting.
Yeah, absolutely.
All right, and we do have a question from Dr. but it kind of aligns with one of these that we have from the week, and so let's go. Question 1, I read where the COVID-19 outbreak in India could impact pharmaceutical production. Are you seeing a disruption in supplies? Do you have a backup plan to critical medications produced there?
Well, I'll start. We have learned throughout the COVID pandemic that disruptions in supply chain for lots of things, pharmaceuticals, PPE, right, was a big problem early on in the pandemic, are a very real thing. And we've worked, and when I say we, I mean our supply chain and sourcing team has worked tirelessly along with our pharmacy team to identify additional sources of everything that we need. Now, that doesn't mean that we're always successful for every single supply or every single drug in doing so, and sometimes we have to choose substitutions. That might not be our first choice. But at this point in time, we are simply monitoring this concern. It's very real. There are a number of things that are produced in India and almost exclusively or primarily 80% in some cases of the world's supply produced in India. And that very well could have an impact sometime soon. But today, as of today, we're both both pharmaceuticals and for supplies in monitor mode, which is really where we've been for the past year. So I think some good news there. We're not really seeing an immediate impact. We know that it could very well happen, and we have plans in place to address that in the best way we know how. Interestingly, there are a couple of drugs that are on a national or global shortage here in the U.S. That have nothing to do with India and nothing to do with COVID, that are related to some other supply chain disruptions that are actually maybe higher on our radar than things related to India at the moment. But of course, we're paying attention.
Yeah. I mean, I think the pandemic has certainly exacerbated supply chains problems globally, but this is something that we see all the time. You know, we regularly have antibiotics that are on shortage because of a natural disaster somewhere, or for some other reason the plant went down. We know that a few years ago when the hurricane hit Puerto Rico, we had a shortage of just normal saline, which is IV fluids we use every day for a lot of patients here, because that's where the production was. So it's not a new thing to have shortages in supply chain. It's just it is a larger problem with the pandemic, obviously.
Okay, how are other metro hospitals doing with COVID-19 admissions? Are patients vaccinated? What do you know?
So we do talk still every week to the physician leaders and the executive team of most, if not all, of the other health systems in the metro. Each place sort of varies a little bit in its own way, but the general trends have been the same. A slight uptick over the past week or two compared to 3 or 4 weeks ago in almost every place, but not anything that's overwhelming us in the sense of total number of patients in the hospital. And the answer to the question, are patients being hospitalized or needing hospitalization, are they vaccinated? The almost universal answer is no. I said we've had one patient here since December that's been vaccinated and needed to be hospitalized. I don't know that we've heard from any other hospital that they've had a specific scenario like that. So almost exclusively the answer is no. Those needing hospitalized are unvaccinated here and across the metro.
All right, so this is the question where I'm going to bring in our doctor. So the question is fact check. Will interacting with a vaccinated person cause miscarriages and changes in your menstrual cycle? And the doctor writes that he works with a lot of women, and if he could also speak to sterility and J&J and AstraZeneca vaccines being made from or involving aborted fetuses. He says he just has women ask about all these things. So let's fact check that. And one of the questions, too, is how often do women miscarry on average? So
the baseline rate for miscarriage is very high, 20%. Kind of depends on how you measure it and when you measure it, but yeah, unfortunately it's very common. And you know, I've been an obstetrician for a long time, so I've talked to women a lot about this over the years. So you know, as far as interacting with somebody who's vaccinated, none of the vaccines we have in the United States are live virus vaccines. They're all either proteins or pieces of the vaccine, and so that really doesn't make any medical sense. There's no shedding of virus, and as far as fact checking, I don't think that's true. And I actually did a search engine last night, and there are plenty of people that back me up on that. So I'm pretty confident in saying that. So something that is a corollary to that, though, that you will also see that might be more biologically plausible are changes in menstrual cycles. So you know, we started by vaccinating people who were older, who probably didn't have menstrual cycles, and then moved down into younger age groups. And so there's probably some biologically plausible mechanisms that there's immune cells in the endometrium, the lining of your uterus where the blood comes from, that you might have an abnormal period when you get vaccinated. Of course, abnormal periods are very common, just as miscarriages. And so as the research progresses, we're going to have to sort out whether it's true or not true as far as being related to the vaccine. We talked about this, you know, I've done vaccine research, and I was involved in the human papillomavirus trials. I mean, we looked at this, you know, 20 years ago when we were doing those trials, but we were doing those trials in college age and adolescent women, and that's a prime group for having abnormal menses. And so that's why you have to kind of tease that out.
And sterility?
Sterility, I think you've asked me about a couple of times on morning media, and the short answer is no. There's no vaccine that's associated with sterility or infertility, and I think, not to get on my high horse too much, but I will get on my high horse a little bit. You know, 20 years ago, or 25 years ago, there were rumors going around Africa that tetanus vaccines caused sterility because neonatal tetanus is a problem, and so it's just a recycled myth, a recycled go-to misinformation, and I can think of at least 4 vaccines it's been tried against, and this is just the most recent vaccine that people have used that misinformation against.
Yeah, and I think we should just talk overall about vaccinated persons. Interacting with people who have been vaccinated causes no harm to other people whatsoever. We know there's some misinformation being used out there for some reason or another, but if you're fully vaccinated, you're protected. You're not going to cause any harm to anybody else. So everybody should be safe to go. We just need those unvaccinated people to get vaccinated as well.
I mean, that's true of every vaccine, too.
Yeah,
I mean, we should,
right,
no vaccines cause infertility, and no
Correct.
vaccines cause disease to spread in the community. So easy question.
Reports are for every 10 deaths in women, there are 13 deaths in men. Why do more men die of COVID than women?
Yeah, I don't think we fully know that, but really since the beginning of the pandemic, especially when you looked at Italy and those initial wave that Italy had, there was a huge preponderance of older age men compared to women. Now there were also comorbidities and other factors in that, but I think since the beginning of the pandemic, we have seen that there have been a slight skew towards men in that more severe and death category. Don't really know why. It could be something with, again, gene function or hormones or some other thing that maybe is not as protective in men than women, but that has certainly been consistent throughout since the beginning of the pandemic, is maybe just a little bit more of a preponderance towards men, just puts you at slightly more risk. I don't know if that risk is significant, but we have seen those slightly increased numbers, just as we've seen on this question.
And I would argue, I think, pretty clearly that there's not one factor that's making up that
Exactly.
difference. Without a doubt, we know that the rate, for example, of morbid obesity and severe hypertension is slightly higher in males than females in general. That comorbid condition that Dr. Hawkinson just mentioned, having an impact on your outcome. And so it would make sense that that is part of the story here, because we know that those two things, morbid obesity and severe hypertension, put you at an increased risk of severe disease or death if you are to contract COVID. And so it's likely that along with a number of other factors, the population itself, when you mention Italy, we know that there was a disproportionate number of older male smokers in that population at the time, and those things were risk factors by themselves. So it is true that the numbers look like this. It's probably, as I said, not any one specific or one single reason.
What about stillbirths linked to pregnant women who caught COVID-19? Is this true?
This is true. There was what we call a meta-analysis, where they put a bunch of studies together in the Canadian Medical Association Journal about a month ago, and for COVID in general, there was about twice the risk of stillbirth, and it goes up from there, so with more severe disease. And so we've known that preterm birth has been increased, but some of that is probably where obstetricians like me go in and cause a preterm birth because the pregnant woman is so ill with COVID. So that's a little bit muddled data. There are some data about toxemia or preeclampsia. That also is biologically plausible because of the inflammatory response. We know inflammation is one of the cofactors in toxemia or preeclampsia. So most of the news about COVID and pregnancy is bad, to be honest with you. So is the short answer to that question.
Yeah, and I would like to say, initially in the pandemic, we thought that mom and baby were fine. A few months ago, the CDC did publish reports saying you actually have increased risk of going to the ICU and severe outcomes as a mom if you have COVID-19 compared to as a pregnant mother if you did not have COVID-19. And now we have a new report out of Journal of the American Medical Association, JAMA, which you reviewed, that was recently published, if it was this week, that shows actually more deficits and harm to baby if you get COVID-19 as a pregnant mom. And that is respiratory distress, also things like hyperbilirubinemia, and that's where the babies turn yellow, where you have to put them under a light. So there are consequences to baby as well if you are a pregnant mother and you get COVID-19. But on the flip side of that, what we have seen is that getting the vaccine if you're pregnant, number one, is safe, and number two, can also confer some protection to baby with some of those antibodies that can transfer from mom to baby. So more and more data saying that yes, if you are pregnant, you should be getting this vaccine, just as you do with other vaccines in pregnancy. And please correct me if I'm wrong with that. But that's very important for mom and baby now, is one more vaccine that we can use.
Well, during the pause for the J&J vaccine, there was an article about this in the New England Journal of Medicine, which probably would have been on the front page if it weren't for the pause going on, about the safety of the first two vaccines during pregnancy. And there were about 4,000 women through the vSafe app that we've talked about before that were enrolled in this study, and basically they didn't find any increase in miscarriages or stillbirth related to the vaccine. And so, in this story, to me, is kind of stacking up like influenza during pregnancy. When I talk to my patients about flu shots during pregnancy, I talk to them about, risk to their own health, risk to the pregnancy, and risk to the newborn. And now the pieces are kind of falling in place with COVID. That looks like there's risk in all three of those categories.
Okay, people with COVID-19 shed virus through coughing, sneezing, and talking. Can vaccinated people do the same? If not, then why do I have to wear a mask?
Dana, you've talked a lot about this week.
Yeah. Again, there are good signals in the data, in the research, both real world but also laboratory data and publications that seem to be, that show that you do have a reduced chance of transmitting the virus to others. But that question is not fully answered. We do have good studies, in particular, like I said, the real world, like in Israel or here with our healthcare workers, showing decreased rates of asymptomatic and symptomatic disease, overall decreased rates of spread of the disease. And so therefore, we do believe that for those reasons, you can transmit it less. We also have some molecular studies looking at how much virus is in your upper respiratory tract if you are vaccinated versus unvaccinated. And it looks like there is less virus in that upper respiratory tract for those vaccinated people. So overall, yes, it looks like you do have decreased viral reproduction. So therefore, we would think that you also have decreased transmission. But again, it's not fully answered. There are good signals in the data to suggest that. But also you have to remember there is a large proportion of the population that continues to be unvaccinated and continues to be at risk of getting the disease, getting that severe disease, going to the hospital, but also spreading it to others as well. That's why masking continues to be important.
Yeah, just like vaccination, right? Masks, you wear them as much for those that you care about, right? There's as much benefit to those in your life that you care about as there is to yourself. And so that's why you still wear a mask. That's why you get vaccinated.
Right. And we do see conservative approaches for vaccinated people to getting back to things and doing things without the mask. But right now, that is why we have to continue to wear the mask.
My husband and I are fully vaccinated. My 82-year-old sister is also vaccinated. Is it safe for me to travel to visit her and stay in her home?
I think the current guidance would be that, yes, fully vaccinated people can do those things. I think we would always recommend that you, in your travels, do what you can to mitigate any risk that might occur. So if you're flying, regardless of whether you're vaccinated, wear a mask, right? Be careful when you're in the airport around the people that you may come in contact with. All of those things that we've been talking about. But as far as the current recommendations would say, yes, that's one of those things. Small groups of families who are not living in the same household can gather without a mask. Staying in their house would be one of those things, assuming that there's not 30 people staying there. It doesn't sound that way, but in general, I think, yes, these are the things, as Dana just mentioned, right? We're trying to come up with these examples of things that are now very low risk related to the benefit of vaccine that those who are vaccinated can do.
Have you heard of adverse neurological symptoms from the Moderna vaccine? I'm experiencing tingling, prickling, burning sensation in the legs going on a month after shot number 1.
I would look to you. All right.
Well,
I have not.
So the way that we would define this, if we were looking at it at a population level, would be what happens 42 days after the vaccination. So we're kind of bumping up against 42 days if it's been a month. So, and the short answer would be no. We're not seeing any unusual signals of neurological diseases. However, it's hard to give medical advice, even though we have 3 doctors here. It's hard to give medical advice specifically. So you should probably talk to your doctor because it's likely unrelated, but it could be something else. You don't want to miss something else.
And I believe, correct me if I'm wrong, for Pfizer they had looked at some other neurological problem, Bell's palsy, and that was found out not to have any association, right? Not higher than any background.
Right. But I should have probably looked this up. But Bell's palsy, a Guillain-Barré, stroke, several things have been looked at. I think this might have been in the MMWR article from a few weeks ago, that they're equal in the unvaccinated and vaccinated populations. So,
If someone had COVID-19, how long do they have immunity? How soon might they catch it again if exposed?
So I would also like to answer the last part, put in another answer for that last question. Please go get your second dose of vaccine.
Oh, sorry.
Yes.
I'm sorry.
Please go get your second dose.
we can say that over and over again.
Yes.
On this question,
Yeah.
right, this is also one of your frequent topics.
Yeah.
Natural immunity, how long does it last? What do we know? And what is the risk of reinfection?
Yeah, I think we have, again, more data signals based on proxies, like looking at antibody levels, that probably natural infection, especially because if you were infected, say late last year or earlier this year before any of the variants, particularly the UK variant, started becoming more prevalent, your immunity is probably not as good with natural infection as it is with these vaccines. So how long do you have immunity? Well, we know from the data you have at least 6 months of good immunity. And again, they're looking at antibody levels for this. This is total speculation. I'll continue to speculate. I'm going to say you're probably going to have strong vaccine-induced immunity for at least a year before anything. It's not unnatural for antibody levels to wane. We know that's how the immune system works. Your antibody levels do tend to wane over time. It's really the importance of having that B cell, that memory B cell function, where you can produce more antibodies very quickly and also continue to have the T cell immunity as well. So pure speculation, I think we're going to show very high immunity levels even at a year. How soon can you catch it again after natural infection if exposed? We've seen cases of, the typical thinking had been 90 days. Anytime after 90 days, you're probably more at risk of getting it again. But a lot of that research in question has kind of gone out the window now with the vaccination, and we're certainly starting to look more at breakthrough infections after vaccination, and then how long your immunity after vaccination lasts as well.
Okay, so we have time for our last question, but I just want to let Angela and Susan and Quetta and Vincent and Isaac and others know I'm going to take those questions, move them to Monday, so tune in. Last question for today. How do we know that unborn and newborns benefit when their moms are vaccinated?
Dr. Alt.
Well, we've mentioned a lot of pregnancy complications like preterm birth and preeclampsia and that type of thing related to having COVID while you're pregnant. So the logical thing would be that if we vaccinated women, that we would prevent some of these complications. That data is going to take longer to find out. So, and I'm guessing it's probably going to come from a CDC system called the VSD system, Vaccine Safety Data Link, because they have unvaccinated and vaccinated controls. And so that data will be forthcoming. We first recommended the flu vaccine during pregnancy in 1960, and it took a few decades, to be honest with you, to get the specific data where flu vaccine prevents stillbirth and preterm delivery during pregnancy. So hopefully it'll be shorter than that. It'll probably be within a few months, but we'll have that data eventually, and that's a great area of research for the students and residents we have here at KU.
Yeah, and I think also, the research article that you reviewed that is recently published is starting to show concrete data that there is protection and health benefits to baby as well.
So many great questions again this week, and as Jill mentioned, already spilling over into Monday. As we go into the weekend and prepare for next week, how happy are you? Truly happy. May is devoted to mental health awareness, and we are going to be spending a lot of time on this subject as COVID-19 has been especially tough on the mental health of many in our community. Dr. Moira Mulhern, co-founder and chief executive officer of Turning Point, is going to help us get our happy back by better understanding our happiness set point. Dr. Mulhern is very smart and very happy, and it will be great to see and hear from her next week. Also, if you're needing an incentive to make an appointment to get your vaccine, come hang out with the official mascot of the Kansas City Royals. Slugger will be at our vaccination clinic on May 5th from 11 to noon. We've got plenty of vaccine and appointments available, so make your appointment now. There are 3 ways for you to make that appointment. If you have My Chart here with the health system, you can use that to schedule your appointment on your own, self-service. Anyone else can go to kansashealthsystem.com/vaccine, or you can always give us a call directly at 913-588-1227. As we wrap up today, any final thoughts, Dr. Alt?
One of the final thoughts that I have is stay tuned, because I'm always worried that something I say is going to be wrong, and I just have to accept that I could be proven wrong. So this is a pretty fast-moving area, as you brought in a study that was just a few days ago, from what we're talking about. So,
Dr. Hawkinson.
Yeah, we're going into the weekend. We know about the new mask mandates. So right now, again, there is no overlying government mandate about doing things, masking, but we still know what protects us against the disease. We know that we can still be thoughtful in our everyday lives when we're going out to do these things. And it's not only for our individual protection, but it's for the protection of people around us in our community. And that should give people a sense of pride and charity to do those things. So please, in those spaces where you cannot separate and you are indoors, continue to be masked, and you don't know if everybody's fully vaccinated, continue to be masked. When you can, do things outdoors. Please keep your spacing, and most importantly, get your vaccine, get you and your loved ones in your bubbles getting those vaccines. And if you are able to come down to our shot clinic, at one point maybe you'll be able to get the vaccine from our little guy here, Cliff's son. He'll make sure it doesn't hurt, but that'll only be on special request. So,
Dr. Will.
Dr. Will.
Yeah, and as I think about reinforcing some of those messages, I think often about how proud I am of all of the efforts over the last 14 months, 15 months now, both of our team and, of course, of the larger healthcare delivery system here in the metro area, but more importantly of our community, about the way, or proud of the way that we have responded over and over again, even when it's been hard. And in the face of changing guidance from the government or requirements, as the case has been this week, and at the same time, some at least concerning signals in number of new cases and what we're seeing and hearing in our hospitals and, of course, in other areas, as we mentioned, schools, for really the first time. Please know that we still have the ability as a community to make a difference. As Dana mentioned, take the pride and the charity of being able to make a difference. We know how to do that, and let's not end up in a place where we're having to ask for more again, because we know that is not very far off if things continue in the path that they are now. So, as we wrap up this week, one final reminder that April is National Donate Life Month. The gift of life is something everyone can decide to do. If you want to be a donor, be sure to talk it over with your family. As I mentioned yesterday, they'll be the ones that will end up making sure that your wishes are carried out. As we wrap up today, please enjoy this video with messages from our solid organ transplant teams. We'll see you Monday. Have a safe weekend.
Through the gift of donation, you are giving people a future, restoring vision, delivering hope, leaving a legacy, saving a life. We are so grateful for families and their donor heroes.